Let us now learn about femoral artery. Femoral artery is the chief artery of lower limb. It is continuation of external iliac artery. Femoral artery is continuation of external iliac artery. Femoral artery enters the femoral triangle by passing behind inguinal ligament at mid-inguinal point. You can see the femoral artery. It enters the femoral triangle by passing behind the inguinal ligament at mid-inguinal point. You can see the femoral artery is passing behind the inguinal ligament at mid-inguinal point. Femoral artery passes through femoral triangle and adductor canal successively. While passing through femoral triangle and adductor canal, femoral artery passes downwards and medially. Femoral artery leaves the canal by passing through adductor hiatus and enters the popliteal fossa. Femoral artery leaves the canal by passing through adductor hiatus and enters the popliteal fossa. Within the popliteal fossa, it continues as popliteal artery. Adductor hiatus is situated at the junction of middle one-third and lower one-third of thigh. Branches of femoral artery. Femoral artery in the femoral triangle gives 3 superficial branches and 3 deep branches. 3 superficial branches are superficial circumflex iliac artery, superficial epigastric artery, superficial external pudendal artery. 3 deep branches are muscular branches, profunda femoris artery, deep external pudendal artery. In the adductor canal, femoral artery gives muscular branches and descending genicular artery. 3 superficial branches within the femoral triangular superficial epigastric artery. You can see the superficial epigastric artery. It supplies the skin of lower part of anterior abdominal wall. Skin of lower part of anterior abdominal wall. Superficial circumflex iliac artery. Superficial circumflex iliac artery supplies the skin along iliac crest. Supplies skin along iliac crest. Superficial external pudendal artery. It supplies skin of external genital organs. You can see the superficial external pudendal artery. It supplies skin of external genital organs. 3 deep branches within the femoral triangular, deep external pudendal artery, profunda femoris artery and muscular branches. Deep external pudendal artery, profunda femoris artery, muscular branches. Deep external pudendal artery passes medially behind the spermatic cord. It passes medially. You can see it is passing medially. It passes behind spermatic cord. It supplies scrotum and penis. Profunda femoris artery. Profunda femoris artery is the largest branch of femoral artery. It arises from posterior lateral aspect about 3.5 centimeters below the inguinal ligament. It arises 3.5 centimeters below the inguinal ligament. You can see this is inguinal ligament, 3.5 centimeters from the inguinal ligament. It gives lateral circumflex femoral artery, medial circumflex femoral artery, perforating branches and muscular branches. You can see the lateral circumflex femoral artery, medial circumflex femoral artery, perforating branches and muscular branches. Lateral circumflex femoral artery passes between anterior and posterior divisions of femoral nerve. Medial circumflex femoral artery disappears by passing between psoas major and pectineus. Profunda femoris artery gives 4 perforating branches. You can see 1, 2, 3 and it terminates as 4th perforating branch. Profunda femoris artery provides blood supply to muscles of all compartments of thigh. Branches of femoral artery in adductor canal. Femoral artery within adductor canal gives muscular branches and descending genicular artery. Descending genicular artery. Descending genicular artery is a branch of femoral artery. Descending genicular artery arises before the femoral artery leaves the canal. Descending genicular artery gives 2 branches, superficial branch, deep branch. Superficial branch is saphenous branch, saphenous artery. Saphenous artery accompanies the saphenous nerve. You can see this is saphenous artery. It accompanies saphenous nerve. Clinical correlation. Compression of femoral artery. Femoral artery is compressed at mid-inguinal point against the femur head to control bleeding from distal part of the limb. Femoral artery is compressed at mid-inguinal point against femoral head. We compress it to stop bleeding from distal part of the limb. Pulsations of femoral artery. Femoral pulse. Femoral pulse is felt at mid-inguinal point against head of the femur. Cannulation. Femoral artery is preferred artery for cannulation. It is preferred vessel for performing coronary angiography. As the femoral artery lies quite superficial in femoral triangle, it is preferred vessel for cannulation. Vascular sign of Narath. In case of posterior dislocation of hip, femoral artery cannot be palpated against head of the femur, as the head of the femur is displaced. This is termed as positive vascular sign of Narath. In posterior dislocation of hip, the head of the femur is displaced, hence the femoral artery cannot be palpated against head of the femur. This is known as positive vascular sign of Narath. Let's now revise branches of femoral artery. Femoral artery within the femoral triangle gives 3 superficial branches and 3 deep branches. 3 superficial branches are superficial epigastric artery, superficial circumflex iliac artery, superficial external pudendal artery. 3 deep branches are deep external pudendal artery, profunda femoris artery, muscular branches. Within the adductor canal, femoral artery gives muscular branches, descending genicular artery. Superficial epigastric artery supplies skin of lower part of anterior abdominal wall. Superficial circumflex iliac artery supplies skin along iliac crest. Superficial external pudendal artery supplies skin of external genital organs. Deep external pudendal artery supplies scrotum and penis. Profunda femoris artery supplies muscles of all the compartments of thigh. It gives lateral circumflex femoral artery, medial circumflex femoral artery, muscular branches, and perforating arteries. Descending genicular artery, it gives one superficial branch, one deep branch. Superficial branch is known as saphenous artery, and deep branch is articular branch that supplies knee joint.